Hi, my name is Patricia. I am a registered nurse and an insurance agent. In this video, I am going to go over why I would choose a Medicare Advantage plan versus a Medicare Supplement if I was in this situation. So if you want to know why, keep watching this video. Like I said, I am a registered nurse. My office helps clients enroll in Medicare Advantage plans, Medicare Supplement plans as well, drug plans, and other products. If you would like assistance, you can call us at this number and we'll be more than happy to help you. Our services are 100% free. I will leave all of my contact information in the description box, and I will leave my number right here as well. All right, so in this video, we're going to use a realistic case scenario. We're going to use Mrs. Jones. Mrs. Jones is 65 years old. She just retired from her job. She makes about $900 a month in her Social Security check. She still has a mortgage and basic bills. Mrs. Jones is pretty healthy. She's active. She likes going out with her friends and such. And she likes spending time with her family as well. Now remember, Mrs. Jones makes only $900 a month in her Social Security check. Today we're going to use a real quote that we gave Mrs. Jones. Before we get into the case scenario with Mrs. Jones, let's talk about what is going on in the world today. The prices of homes have doubled. The price of rent has also doubled. The cost of food has went up. So the cost of living is very expensive today. And that could be very devastating for a senior, okay? So this case scenario is going to be geared for low-income seniors. So let's get started. So today we're going to look at some options for Mrs. Jones, a Medicare Supplement plan or a Medicare Advantage. In this case scenario, she did choose a Medicare Advantage, and we're going to explain why in this video. In this case scenario, we looked at a great supplement plan, G, with a great company that has really great history with their rate increases. Mrs. Jones lives in Florida, and we're going to use the zip code of 32712. This supplement plan is $179.83. Miss Jones will also have to pay her Part B premium, which is $170.10. She's not on any expensive drugs, so we also recommended a drug plan that is $7.70. Now her total cost would be $357.63. So in this case scenario, the number one reason to go with the Medicare Advantage plan is simply the supplement plan route is just too expensive. Now, before we dive deep into options for Mrs. Jones, I do want to say this. A Medicare Supplement plan is a great option. You can go to any doctor that takes original Medicare that are taking new patients. So that is a great benefit when it comes to Medicare supplements. You can also travel with a Medicare supplement plan, but a Medicare supplement plan is not for everyone. Before we move forward, let's go over this misleading chart. This chart has been going around for years, and I want to take the time to address it. This chart goes over original Medicare versus a Medicare Advantage plan. When you see the chart, it's very misleading. So you have two options. You have original Medicare with a supplement plan, or you could do a Medicare Advantage plan. Both plans are contracted by private insurance companies. Now let's dive deep into this chart. So it says Medicare versus Medicare Advantage. The first column says you and your doctor chooses your care. The second column says your plan chooses your care, not you and your doctor. This is very misleading because it's simply not true. Now with the Medicare Advantage plan, yes, these plans are managed by insurance companies. So for an example, say if you had to go to a skilled nursing facility, say you fractured your hip and you needed rehab. Well, every week the skilled nursing facility will have to send updates to the insurance company, letting them know how you're doing and how is your progress. With those notes, the insurance company will recommend if you are able to stay in the facility or if it's time for you to go home and get home health care. So the insurance companies are there to help manage your care, but that does not mean that you don't choose your care and your doctor is not involved. Very misleading. All right, let's go to the next column. It says no referrals needed. This is true with a supplement. Now with a Medicare Advantage plan, you can get on a PPO plan and no referrals are also not needed. So this is also misleading. Let's go to the next column. It says no restrictions. And it says under the Medicare Advantage, limited specialists, also not true. You are not limited on specialists just because you have a Medicare Advantage plan. Now let's talk about on the Medicare side, it says no lab fees. So they're talking about, if you have supplement plans, you're not going to have lab fees. With a Medicare Advantage plan, it says MRI and outpatient has high fees, and this is also misleading. If you look at your summary of benefits, it would tell you what your fees are. Okay, so on the first column, it says no pre-authorizations, and on the second column, it says upfront copay on ER visits. Now, this is the only column I would say that is somewhat true, okay? So on the Medicare Advantage side, yes, you do need pre-authorization for certain tests, or if you go to a skilled nursing facility because you broke your hip and you need rehab. So yes, you will need pre-authorization. Now there are copays if you go to the emergency room and you don't get admitted to the hospital, okay? Now let's talk about the column where it says no hidden costs, and then it says high deductibles for a Medicare Advantage. This is just misleading, okay? So there is no hidden costs on both sides, and there may be deductibles for certain things for the Medicare Advantage side, okay? But to use the word high deductibles, I don't know. To me, I feel like that's just another way to put fear into someone. All right, so let's talk about the last column. It says with Medicare, you are fully covered. With a Medicare Advantage, you have limited coverage. Let me tell you how this actually works. Okay, so original Medicare covers 80%, 80%. You are responsible for 20%. So you have two routes to go. You could get original Medicare with a supplement, and the supplement will cover that 20%, right? So that will help you with 100% of coverage. With a Medicare Advantage plan, it also helps with that 20%. With a Medicare Advantage, what happens is you have copay, so you pay as you go. Okay, so with a Medicare supplement, you're covered 100%. Okay, with a Medicare Advantage plan, you're also covered. You still get help with that 20%, but you pay copay. So you pay as you go with a Medicare Advantage. With a Medicare supplement, it's like you are prepaying for your health care. The thing with a Medicare supplement is that you could be on a Medicare supplement plan for, let's say, 10 years, and after 10 years, you just no longer can afford it. The Medicare supplement plans, monthly premiums do increase every year. What happened is some people will actually change their plan from a supplement to a Medicare Advantage because they simply can no longer afford it. Medicare supplement plans are great. Medicare Advantage plans are also great. Both plans are great. No plan fits all. You just have to pick the plan that best fits your needs. Now let's look at some Medicare Advantage plan options for Mrs. Jones. Let's look at this great plan right here. This is a real life case scenario. This is a real quote, okay? So her monthly premium for this plan is $0 per month. To see the doctor, she would pay $0 to see her primary care physician. To see the specialist, she would pay $5 to see her specialist. Her max out of pocket is $2,750. That just means that she would not pay more than $2,750 for the year. Say God forbid she end up in the hospital or something like that. That is the max that the insurance company can charge for that year. Okay, so that is a really great max out of pocket. All right, so let's look into this plan a little further. So her monthly premium is $0 per month. So she's not paying anything extra for this plan, for this Medicare Advantage plan. Now, I hid the name of the insurance company because I did not ask for their permission to post this video, and I don't want to be asked to take this video down. Now, let's look at the annual medical deductible. It is only $0. So that means she don't have a deductible. If she needs to see her doctor, she can see her doctor right away. All right, so let's talk about the max out of pocket. The max out of pocket here is $2,750. That is the most that you would pay for co-pays, co-insurance, and other costs for medical services for the year. So basically, once you reach your max out of pocket, the insurance company pays for 100% of the services for that year. So the max out of pocket amount is very important. So you always want to know what is the max out of pocket for the year for your insurance, okay? Your monthly premiums does not go towards your max out of pocket or services billed by providers that is out of network. So what goes towards your max out of pocket is co-pays and co-insurance and other costs for medical services for the year. Like I said, once you meet that max out of pocket, then the insurance company is responsible for your bill at 100%. So that is good to know what is your actual max out of pocket. So it's important to understand that your max out of pocket is not what you have to pay. The max out of pocket is the max that you may pay, okay? If a tragedy happened and you had a very high, let's say, hospital bill, the most you would pay is that max. So it's good to know that. So her hospital stay is $25 for days 1 to 3. So days 4 through 90 would be $0. Now, if she end up in the nursing home, the first 20 days will be $0 as well. Co-pays will start at day 21. This plan also offers extra benefits such as dental, hearing, vision, fitness, over-the-counter meds, transportation, telehealth, and savings on certain insulins. Here are a list of preventative services at no additional cost when you see in-network providers, all approved by Medicare. These are all the services that are covered, like I said, at no additional cost. So it's very important to take note that all Medicare Advantage plans are not equal. It depends on the state you live in, even the county you live in. So all the Medicare Advantage plans are not the same. They're all different in certain areas. So I want you to understand that this quote that I gave is very realistic. It's a real quote, but that doesn't mean that you'll be able to get that plan in Chicago or wherever you are. So like I said, it's good to have a Medicare agent look over these plans with you to help you find what's best for you. So this chart just represents that Medicare Advantage plans are not equal. You can see that the co-pays and everything are all different, and even the monthly premium, they're not the same at all. So to wrap this video up, here are the 4 main reasons why Mrs. Jones chose a Medicare Advantage plan. Reason number 1, the 0 or low monthly premium costs. Simply because she can't afford a Medicare Advantage plan and she could not afford the Medicare Supplement. Reason number 2 is affordable co-pays with a Medicare Advantage. So with a Medicare Advantage plan, in this scenario, her primary care physician was $0. To see the specialist was $5. Now, I do want to say this is not going to be the case in every area. It definitely depends on where you live. So it's very important to seek out a insurance agent that can assist you And like I said, our office do this all the time. It would be our pleasure to help you as well. Reason number 3 is extra benefits such as dental, vision, hearing, transportation, over-the-counter meds, fitness. Supplements just don't have these extra benefits. Reason number 4 that Mrs. Jones chose a Medicare Advantage plan over a Medicare Supplement is that she don't have to have a separate drug plan. The Medicare Advantage plans come with drug plans. So those are the 4 reasons that Mrs. Jones chose a Medicare Advantage plan. Thank you so much for watching this video. If this video helped you, please share this video with a friend. And I will see you on the next video. Thank you so much for watching. See you on the next one. Bye.